I'm Dr. Kat, a board-certified plastic surgeon, and I am honored that you chose me to be your plastic surgeon. As my patient, you have a responsibility to follow your pre- and post-operative instructions in order to ensure the best possible results. Plastic surgery is not a destination. It is a journey, and along this journey, there are steps that you must follow in order to ensure that it is exciting, enjoyable, safe, and an overall wonderful experience. So please watch this video carefully as I review your instructions. Now myself and my medical assistant Veronica will review the pre- and post-operative instructions for your surgery.
Hi, I'm Veronica, Dr. Kat's medical assistant. I'm so excited for your upcoming surgery and to be a part of this journey along with you and Dr. Kat. I'm here to give you all the information and instructions you need in order to have a successful outcome.
So Veronica, how do you think we can make people remember the instructions and follow them? Should we just send them the video like over and over again?
I just wish I could follow them around and make sure they follow all the instructions.
Well, I know that sometimes you just try to scare them and tell them this could happen, like your skin's gonna die.
I know, my scare tactics are kind of rough though.
But I think then they have like nightmares. Like I've had patients tell me, oh my God, Veronica told me if I don't listen, then...
I'm just trying to warn them because I told them if they don't follow instructions, Dr. Kat will be upset.
Oh yeah, no wonder they come and they're like, don't be mad at me, but I accidentally, blah, blah, blah.
I know, they have like this fear. No, but it's really important. That's why I do that.
No, it is important, and I think a lot of doctors don't emphasize proper post-op instructions, and then they have some outcome, something happens, and then it's too late. So in the end, I just want everyone to be able to follow instructions and have a good result, not mess up anything that I've worked so hard to do.
Exactly, I agree. As long as they follow their instructions, nothing should go wrong.
Maybe if we make the video more funny, then they'll remember it better.
I feel like we're pretty funny, right? People think we're funny.
Sometimes I'm funny. I don't know. Most of the time I'm pretty serious. Okay, so let's start with 2 months before surgery. Okay, so 2 months before surgery, Veronica, what's the most important thing?
To stop smoking.
Yes, and this includes, first of all nicotine products, so gum, electronic, anything with nicotine in it, and then also the other inhalants that they also ask about.
Don't smoke pot, yes, that counts. Nicotine gum, things like that, hookah, don't go out to the bar, like just please.
But yes, also this includes any inhalants because obviously while you're under anesthesia, you'll be on the anesthesia machine. So anything that affects your lungs will affect the way that you recover from surgery and also minimize complications. So please, no inhalants, no smoking, no nicotine of any kind. And nicotine can interfere with the blood flow to the skin, and that affects wound healing. So potentially your skin could die, fall off, your wound's not gonna close. So please, it is very important.
The last thing that you want is to have this beautiful fat grafting to your booty and then it's gone because you smoke.
I will literally cancel your surgery if you do not follow the nicotine instructions. So please do not smoke anything.
I've seen it happen.
Okay, so then also around this time, you're gonna need to have help after surgery. I know that some of you feel really heroic and you're super tough, but really you need to have some help. So call your friends, family, anyone after surgery that you think.
Anyone that will help you.
And also, you cannot drive after having anesthesia. You cannot throw yourself in a cab. You need to have a responsible adult for the first 24 hours.
Yeah, and Uber doesn't count either because you're gonna be by yourself. We need somebody who can drive you home, get you settled, make sure you take your medications so that you'll be recovering in peace.
And also, if you are having a more extensive surgery, you may need to stay in one of our plastic surgery aftercare facilities, so they will be able to help you. And if you want to stay for more days, just let us know. We'll help you arrange that.
I know, I want to stay there. Can I just go and stay there for a little? I have them pamper me, take me to the bathroom, give me my medication.
They'll wash your hair.
They do everything
for you.
They'll do
your drains.
You need to go there.
They'll get stuff for you. Now, 2 weeks before surgery, so this is where it really becomes important. You really need to pay attention. It is so important to stop all aspirin, Motrin, ibuprofen, Aleve, vitamins and herbals, alcohol, 2 weeks before and after surgery. Even my daughter knows this. She repeats it a ton of times because I say it so much.
Just cleanse yourself. Take the opportunity to make sure that your body is nice and clean for any additional substances, and do not take Advil. She will cancel your surgery because of Advil too. Yeah, no, even if you have a headache, take Tylenol. Don't take Advil.
Yes.
If you have cramps, take Tylenol, not Advil.
And if you have any questions about something, please ask. But in the end, you're just going to be able to take Tylenol. And pretty much you're going to have to stop everything else because all those other things could potentially make you bleed in surgery. And as you know, I hate any blood in my surgical field, and I want you to have a really, really great, easy recovery.
2 weeks before surgery, please do not overexpose yourself to the sun or get a sunburn.
Yeah, you really do not want to have your skin peeling off in my surgery site. Please do not do that.
Save the bikini body for after the surgery.
Yes, then you can safely tan with sun protection, of course.
And you can show everyone how you look.
The week before surgery, please let us know if you have a cough, a fever, any illness, or if you have any sort of skin changes or infections. If you are feeling sick or have a cough, please do not take over-the-counter medication without asking us. You also want to start thinking about what you'll need going into surgery. Most importantly, pick up your medications. Don't wait till last minute.
I don't want to be running to the pharmacy during your surgery because the nurse tells me, oh, she doesn't have this, or oh, she doesn't have that. So please prepare ahead of time.
And when you go to the pharmacy, you can also pick up the special soap that we recommend, the Hibiclens. You should be able to find it in almost all pharmacies in the cleansing aisle with the alcohol and peroxide. It's a green bottle. It's really easy to find. And also the TED hose. So we recommend using TED hose that is above the knee because when you're recovering from surgery, you don't want to be constantly pulling them up. They have thigh-high ones, and they don't have to be overly tight.
No. Please don't get them too tight because then we can't get them off of you.
Yeah, so less than 20 millimeters of mercury, anything that feels comfortable because you're going to have to be in the TED hose for at least a week after your surgery. It helps with your circulation and prevents you from getting a blood clot.
So 2 days before surgery, we want you to cleanse your body with the soap that we told you about. And
The
just make
Hibiclens.
sure you wash it really good, keep it on for like 2 minutes, scrub in all the creases, in between the breasts, underneath,
And
in
the belly
armpits,
button. The
and
belly button.
Yes.
We have found all kinds of things in the belly button.
Get a little
I will
Q-tip.
personally clean it in your surgery. However, please, if you can remove bacteria, all kinds of lint, debris from your belly button before surgery,
Yeah.
that will help keep it clean, minimize any chance of infection.
And your back as well. Make sure you scrub your back because you don't want to be on the operating table and they're cleaning you and they notice like they didn't clean their back.
Also, shave. Please remove all hair from areas around your surgery site 2 days before so you don't have any open cuts or wounds. So shave and start using the Hibiclens washes 2 days before surgery.
We don't want Dr. Cat to have to search through a national forest to find her incision site.
Yes, and we'll just end up, the nurses will end up shaving you on your operating room table, and it's just gonna, you're gonna pay for that extra OR time, so just don't do that. Shave before.
So 2 days before surgery, also please try to stick with a light diet. So even though you're not going to be able to eat after midnight the day before your surgery, don't go like to the nearest In-N-Out and get a burger and fries.
Yeah, don't go to Disneyland and pig out because I actually had a patient who did that.
Yeah.
And when I did, because you don't want to be bloated during your surgery, some of the pain medication may also make you constipated, and you just don't want to be full of food and constipated after your surgery. You'll be miserable.
Trust me, it's not an issue that you want to have. You want to be able to focus on recovering and not be worried about your bowel movements.
Yeah, so eat light the day or two before surgery. Okay, so the night before surgery,
Oh, we're getting closer to your transformation.
please do not eat or drink anything after midnight, and this includes drinking water. Now, you can take your medication if you have high blood pressure pills with a small sip of water the morning of surgery, but otherwise, please do not eat or drink anything the night before surgery.
That also includes mints, gum, anything that you put in your mouth. Please, just midnight, nothing.
Also, please do not put lotions, deodorants, creams, or anything like that on your skin. I'm going to be marking you just before we go into surgery, and so that will keep me from being able to mark you appropriately.
And also, you don't want to wear any valuable jewelry or contacts to the surgery
Yeah,
center
we
the morning of
trust
surgery.
our nurses, but hey, if it's like
We just
something, yeah.
can't be responsible.
Not us.
You be responsible.
And also just wear loose, comfortable clothing. I mean, please do not wear super tight leggings or pants, just something that you can get in and out of easily.